All right, in the distance you can see something that's worth a lot of money, and in front of it you can see someone who can save you a lot of money. And this video is about health. And to start off, I think this website might be called Dr. Tony. Well, I'm no doctor, I'm a dentist. However, many years ago, when dentists were after some money on the health service, they said, "Oh, we won't give you any money, we'll call you doctor." And you're thinking, oh, wasn't that bothered about the money, but calling us doctor, you know, like, well, back then a consultant was a consultant, now everybody's a consultant. But anyway, that's enough of me, and this is what I'm trying to do. We're trying to improve everybody's health, and as you say, is dentistry. Well, you improve health one tooth at a time. But do you know your BPE? Right, most of you now are thinking, God, this guy's talking nuts. Well, your BPE is similar to your BP, it's similar to your BMI, right? But whilst you can alter the others and check themselves on them, you can't really check yourself unless you see a dentist or a hygienist for a BPE. But you might be able to soon. And there's a video there showing you what to do. Links up everywhere, rather than look at my face, so hopefully you can't see me now, I'll be tucked in a corner. But this is a site that you can go on to learn about health and download the app. And in the app I explain about a BPE. And as I said before, you have to have it measured. And then when you're the dentist next time, if you're fortunate to see one, then ask what your BPE is, right? There's another way of testing yourself. So if you just check how your gums bleed, and here's a site now showing you how to check if your gums are bleeding. It doesn't work with if you smoke, but then whoever said smoking was good for you, it doesn't really help. So it doesn't work for if you smoke. And in fact, actually, here's another video. So on this video, it shows how you can check yourself for gum disease and general health, right? So part of it is a section there showing you BPE. And if you fill it in, it'll tell you how close you are to losing your teeth. And it kind of has a relationship towards oral cancer. But if you fill in all the details here, then and fill them in honestly, rather than on a piece of paper that you're going to hand in hoping that the dentist isn't going to tell you off, then you can kind of decide what you want to do. Unfortunately, if you smoke, well, I'm dead against smoking, don't get me wrong. And in Bristol here, we've got a lot to answer for regarding smoking, because we encouraged it by giving out free cigarettes in the First World War. And look what happened there. But that's business for you. They knew what they were doing. Yeah, anyway, smoking, I don't agree with smoking. Now, drinking is a slightly different matter. Eating, well, I like eating. And what was the other one? So there's certain things that can bother you. So what's it? So the smoking, that's not good for you. Drinking, that's not good for you. I like eating, but if you eat the wrong things and eat too much, that's not good for you. Sex, well, you have to be careful about that one, but that can't be good for you. And stress. Well, no one has any stress. As a dentist, we were never stressed, and I'm sure whatever you do, you weren't stressed. And and the other one was diabetes. Well, that's related to, for a lot of you, to eating. So all these factors have an effect on you. And and if you fill in the chart, it will also show you how at risk you are to cancer. Well, if you're going to check yourself for oral cancer, check yourself for all cancers. And again, it's in this app, which is, it's free. That's right, it's free. So it doesn't cost you anything. In fact, it doesn't cost you anything to check yourself once a month. And what we do know is that if you're spotted early, then the likelihood of a good outcome is far, far better. Now, I know this is awkward, but lots of my patients, I actually surveyed my patients before I decided to do this, to see how many would want to check themselves. And I thought, that's a given. So 10% of the people, I said, would you prefer me to check you once a year, or would you prefer to check yourself once a month? Yeah. They wanted me to check themselves once a year. And that was not the outcome I expected at all. And it's not enough. It's not enough. You need to check yourself once a month. And while you're at it, I always say, well, do it while you're in the bathroom and when you're in the shower, And that's a good place to sort of have a little poke around. Well, I'll put a video about that on. And you should do it for yourself. And if there's anything on there, well, you can use this mobile phones to take a photo. So I was making a video show how to check yourself in the mouth and send a photo in. Well, we'd call that teledentistry, wouldn't we? It'd be brilliant if we had teledentistry. But, it's difficult, isn't it? Nobody wants to really have any treatment. But if you let us know sooner, the actual nonsense is some things you can get away with, and if you change your habits, then you can improve upon. And so what you could say is, if you look after your teeth, you know, it's less likely that you'll suffer from other diseases. We're not just talking about cancer, we're talking about diabetes, we're talking about, well, well, I'll come to that now. The BPE, yeah, I got sidetracked, I always get sidetracked. Your BPE, well, actually, what it is that area between your tooth, where it appears against your tooth, and the gum. And that area is covered in what we used to call plaque, and we've now changed the name, it's called biofilm. And the way that it works is, it's how the gum or the body reacts to it. So the body's reacting to it almost like an autoimmune disease. And no mouthwash is really going to cure it, it'll disguise it. You need to brush them. People have arrived to look at Banksy. Yeah, so you need to brush them. And there are videos here showing you how to do that. And if you don't smoke and you can't get to see a dentist, the good indication is if your gums are bleeding. Now you have to think, if your gums are bleeding, right, there's blood coming out, then all kinds of things can go in. So you now know, I'll put a video up there, and showing you how to check yourself, or rather not how to check yourself, how it's all related to different diseases, how these bacteria get into the bloodstream, and they can cause, well, it can cause heart disease, maybe related to Alzheimer's, it's definitely related to kidney disease. Oh, and yeah, I stuck this one on as well. And I thought I'd put that one on, trying to be funny, but this one was obviously promoted in The Sun, and I made a video on that. And then, well, you know, that was an old one, so I put one of these, and you know, it looks more fancy, but the message is the same. And with regards to teeth, it hasn't changed. You have to do it. You know, 2 minutes twice a day, spit out, don't rinse. I'll make a video on that. God, if we can think that long. Yeah, and swish the toothpaste between your teeth. You know, lots of people now saying you don't need to floss, and given the choice at my age between flossing and using interdental brushes, it's interdental brushes all the time. And if you've got implants, you probably ought to use one of these, and I'm not plugging them, but if you have them done in the States, they give them free, along with the $5,000 implant you've just had. You get this water irrigation free. So, you know, these videos I'll do, I'll try and do them in a manner that you kind of understand, but I'd be grateful for your feedback. Yeah, so the final one is about food. This video I've made on food. Have a look at that, because actually we're going to say in 20 years' time what we did with food was similar to what we did with tobacco. And we probably do the same thing about alcohol, to be honest. But, you know, there are only so many things you can talk about. And now the lorry's coming. I'll leave it at that.